I'm Ed Highland. Welcome back to the Big Ideas Theater here at the AARC Congress. And I'm joined now by Kim Bennion, who's with Intermountain Healthcare. And thank you so much for coming by. A big question, and I'm going to have to read it off here because there's a lot to this information. Did your organization just ask Respiratory Care Services to lead your advanced care planning process out of the blue?
They actually didn't. They actually did not. I think it speaks to the fact early groundwork and preparation makes you uniquely available and ready to take on a new project. And we had done about 4 years of COPD research and found that our patients were really not dying where they wanted to die. And if you have these rich conversations, it affords the opportunity for them to express themselves. And so we went into the home and had these conversations. And with a big reorganization, that's what really precipitated us inheriting it, because 3 of the larger leaders had been displaced with the reorganization, but respiratory had been along. We'd gone for certification to lead the discussions, and I think we uniquely positioned ourselves, so it was a natural flow. And now that we're doing it, I don't think they would give it to anybody else.
It's got to be frustrating. I mean, there are just times that you just want to beat your head against. So, I mean, give up. It's just thoughts that you have in your head.
Yeah. Well, when they did the reorganization and people stepped away, and now I inherited the entire grant to do all of the work, we had also gone and certified in another organization's advanced care planning discussion facilitation. And we're told 3 days before we were to do a large training that, no, you can't use our materials. We don't have a contract signed. So we just got really creative, and over the weekend we built our own information pamphlets, booklets for the patients, fast-tracked it, and it was a success.
Over a weekend you did that?
We did, and we had patient feedback with it. I think that's key and paramount. So our patient family advisory panel for chronic lung disease helps us create a lot of the educational discussion tools and discussion aids. And it's been phenomenal that way, and that we had to, out of necessity, reach to them, and it's just been a great success because there's buy-in now, and it's patients talking to patients. So it's been highly successful. But yes, halfway through I thought, why did I do this? Why did I even start down this path? And I think that's happened with creativity. I think that's what happens.
Are there other obstacles that you've been coming across? I'm sure there are obstacles, and if you can give us some ideas how you overcame those barriers.
You betcha. At first, I had no physicians that really wanted to participate. They were like, just one more thing. It's the soup of the day. But now I have about 7 physicians who are actively engaged, and they want to be medically leading part of our initiatives because it's been successful. And I think sometimes you have to show and tell, and then you'll get other people who also want to do.
Can you give us some thoughts on perhaps what's been most rewarding for you out of this project, the ACP project?
Absolutely. I think it's the volume of patients we've been able to reach and have these really rich conversations about their lives, about their values, about their beliefs, and then help them build their care plan of what healthcare choices they want, whether it's life support or to be at home and get those documented. It's these super rich conversations that then lead to like healthcare goal attainment scaling, where they're picking, for example, one patient, it wasn't like, I want you to quit smoking. I never said that to him. He wanted to get his dog certified as a service dog. It was those things. And building upon those goals that finally came to fruition, he now has been smoke-free. And that man has smoked since he was 10 years of age, and he's been 2 months and 1 week today. So.
Wow, that is impressive, especially for a lifelong smoker. Some thoughts, if you would. Your organization is pretty well known, but can what you've been able to do, is that something that can be replicated in today's world? It's not always easy to either get the dollars or the people to make things happen.
Absolutely, it is translatable, and I've said 100 times, willing to share anything and everything that we've done to help get a jump start. But sometimes I think you just need to do a small test of change, even if it's 10 patients. Trial something, a big idea that you have, but yes, I'll share anything, and see if it can't be impactful with just even 10 patients. And I think if you can do that, it'll speak to both those who are concerned about what you bring in from a budgetary standpoint, your bean counters, but also to clinicians for the high quality of care. And then include your patients. That's translatable anywhere, right? High quality, personalized healthcare, you can't go wrong with that.
Sounds like a personal and professional challenge to the folks who might be watching, so take her up on it.
Yeah, please do.
Kim Bennion, thank you so much for joining us and sharing this important information today.
Thank you.
This is the Big Ideas Theater. I'm Ed Highland. Thanks for joining us.